How's it going, guys? So slightly unusual question. This has shown up on a student's real USMLE. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. Really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question here. 45-year-old woman. She's brought in to the hospital by police. She was found sleeping in the snow. Her breath smells of alcohol. She appears slightly emaciated and confused. Confusion in the setting of alcohol, we could think of things like Wernicke, okay, B1 deficiency. Temperature clearly hypothermic, should be 98.6. She's rewarmed in the emergency department using heating blankets and warm IV saline. So a picture of her feet is shown, and you say, what the fuck, okay? So this is showing increased perfusion, hyperemia, secondary to rewarming. Okay, not crazy, nothing dramatic. So I'm just going to walk through the answer choices here. So hyperchloremia, hypochloremia, the chloride answers, they're never going to show up on USMLE. Okay, they're just here as distractors. Nothing you need to know about chloride. It is the least important variable for USMLE, apart from just knowing it's part of anion gap. Okay, when we calculate mud piles type acid-base disturbances, it's part of calculations, but never actually a formal hypo or hyper diagnosis that you need to know. Hyperkalemia is the correct answer here. Now, when we rewarm tissues and we get hyperemia, we can get free radical damage due to increased oxygen delivery. Okay, this is no different from reperfusion injury when we have MI and we do percutaneous coronary intervention. Okay, and we can get increased CKMB, increased troponins following stenting. Okay, so reperfusion injury due to oxygen radicals, very fucking important. Patients can not, so the reperfusion injury here, this can actually cause rhabdomyolysis, especially in the setting of alcohol, big risk factor for rhabdo. So not only will the lysis of muscle cells release potassium into the blood, causing increased serum levels, but also myoglobin is nephrotoxic. It can cause acute tubular necrosis, acute renal failure, which will also increase potassium levels. So when we rewarm tissues in general, but especially in alcoholics, we worry about things like rhabdo. We want to make sure we look at potassium. Potassium can cause cardiac abnormalities, okay, arrhythmia. So we also want to have the patient on an ECG. Sodium, in contrast, hyper versus hypo, can cause CNS dysfunction, okay, confusion, coma, especially. Just hypernatremia, if we have diabetes insipidus, okay, that's a high yield cause in USMLE, high serum sodium in the setting of dilute urine. In contrast, hyponatremia, SIADH, and we have concentrated urine, all right? There's lots of discussion points regarding electrolyte disturbances. We could make this an extended clip. Hyperphosphatemia can be seen not only in the setting of hypoparathyroidism, we can also see it in secondary hyperparathyroidism due to renal failure. We can also see high phosphate in the setting of tumor lysis syndrome, okay? Hypophosphatemia is refeeding syndrome. That's a weird one, okay? But especially high yield on 2CK. If a patient has not been fed for a while, does not have to have low BMI, okay? If a patient has not consumed any food in a while, and then we give a lot of food very quickly, we can get trapping of glycolytic intermediates by the liver, okay? So phosphate needed for the formation of glycolytic intermediates, and we can get a transient decrease in serum phosphate. So refeeding syndrome, hypophosphatemia, high yield. Metabolic acidosis, alkalosis, I mean, obviously things to consider, okay? I mean, for sure. We can get lactic acidosis due to alcohol. So definitely considerations. I mean, we have a challenging question here, but we clearly have rewarming in the setting of alcohol, potential rhabdo, and we're going to have to think about our potassium levels here, okay? Rhabdo is nephrotoxic, cause acute tubular necrosis, high potassium, and release of potassium into the blood due to the lysis of muscle cells, as I said before, and we're going to have the patient on ECG. You know the deal. I'm going to continue making more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.